Breast cancer is a disease that structures in the cells of the bosoms. After skin malignant growth, breast cancer is the most well-known disease analyzed in ladies in the United States. Breast cancer can happen in the two individuals, however it's undeniably more normal in ladies. Generous help for breast cancer mindfulness and examination subsidizing has made advances in the finding and therapy of breast disease. Breast cancer endurance rates have expanded, and the quantity of passings related with this infection is consistently declining, generally because of elements like prior recognition, another customized way to deal with treatment, and a superior comprehension of the illness. Indications. Signs and indications of breast disease may include a bosom bump or thickening that feels not the same as the encompassing tissue, change in the size, shape or presence of a bosom, changes to the skin over the bosom, for example, dimpling, a recently upset areola, stripping, scaling, crusting or chipping of the pigmented space of skin encompassing the areola, or bosom skin, redness or pitting of the skin over your bosom, similar to the skin of an orange. When to see a specialist. On the off chance that you discover a knot or other change in your bosom, regardless of whether a new mammogram was typical, make a meeting with your primary care physician for brief assessment. Causes. Specialists realize that breast cancer happens when some bosom cells start to develop strangely. These cells partition more quickly than sound cells do and keep on collecting, shaping a protuberance or mass. Cells may spread, metastasize, through your bosom to your lymph hubs or to different pieces of your body. Bosom disease frequently starts with cells in the milk creating channels, intrusive ductal carcinoma. Bosom disease may likewise start in the glandular tissue called lobules, intrusive lobular carcinoma, or in different cells or tissue inside the bosom. Analysts have distinguished hormonal, way of life and natural factors that may expand your danger of bosom disease. Be that as it may, it's not satisfactory why a few group who have no danger factors foster malignancy, yet others with hazard factors won't ever do. All things considered, bosom disease is brought about by an intricate association of your hereditary cosmetics and your current circumstance. Acquired bosom disease. Specialists gauge that around 5 to 10% of bosom tumors are connected to quality transformations went through ages of a family. Various acquired changed qualities that can improve the probability of breast cancer have been distinguished. The most notable are bosom malignant growth quality 1, BRCA1, and bosom disease quality 2, BRCA2, the two of which fundamentally increment the danger of both bosom and ovarian disease. In the event that you have a solid family background of bosom malignant growth or different diseases, your primary care physician may prescribe a blood test to help distinguish explicit changes in BRCA or different qualities that are being gone through your family. Think about asking your primary care physician for a reference to a hereditary instructor, who can audit your family well-being history. A hereditary advocate can likewise examine the advantages, dangers and restrictions of hereditary testing to help you with shared dynamic. Hazard factors. A bosom disease hazard factor is whatever causes it almost certain you'll to get bosom malignant growth. Be that as it may, having one or even a few bosom malignant growth hazard factors doesn't really mean you'll foster bosom disease. Numerous ladies who foster bosom disease have no realized danger factors other than essentially being ladies. Components that are related with an expanded danger of bosom malignant growth include being female. Ladies are substantially more likely than men are to foster bosom disease. Expanding age. Your danger of bosom malignant growth increments as you age. An individual history of bosom conditions. In the event that you've had a bosom biopsy that discovered lobular carcinoma in situ, LCIS, or abnormal hyperplasia of the bosom, you have an expanded danger of bosom malignancy. An individual history of bosom disease. On the off chance that you've had bosom disease in one bosom, you have an expanded danger of creating malignant growth in the other bosom. A family background of bosom malignancy. On the off chance that your mom, sister or little girl was determined to have bosom malignant growth, especially at a youthful age, your danger of bosom disease is expanded. In any case, most of individuals determined to have bosom malignancy have no family background of the sickness. Acquired qualities that increment malignancy hazard. Certain quality changes that expansion the danger of bosom malignancy can be passed from guardians to kids. The most notable quality changes are alluded to as BRCA1 and BRCA2. These qualities can enormously expand your danger of bosom malignant growth and different diseases, yet they don't make disease unavoidable. Radiation openness. In the event that you got radiation therapies to your chest as a youngster or youthful grown-up, your danger of bosom malignancy is expanded. Corpulence. Being hefty builds your danger of bosom disease. Starting your period at a more youthful age. Starting your period before age 12 expands your danger of bosom malignancy. Starting menopause at a more established age. In the event that you started menopause at a more established age, you're bound to foster bosom malignancy. Having your first kid at a more established age. Ladies who bring forth their first kid after age the 30th of May have an expanded danger of bosom malignancy. Having never been pregnant. Ladies who have never been pregnant have a more serious danger of bosom disease than do ladies who have had at least one pregnancies. Post-menopausal chemical treatment. Ladies who take chemical treatment meds that join estrogen and progesterone to treat the signs and manifestations of menopause have an expanded danger of bosom disease. The danger of breast cancer diminishes when ladies quit taking these meds. Drinking liquor. Drinking liquor builds the danger of bosom malignant growth. Counteraction. Bosom malignant growth hazard decrease for ladies with a normal danger. Making changes in your everyday life may help lessen your danger of bosom malignancy. Attempt to get some information about bosom malignancy screening. Talk about with your PCP when to start bosom malignancy screening tests and tests, like clinical bosom tests and mammograms. Converse with your PCP about the advantages and dangers of screening. Together, you can choose what bosom malignancy screening procedures are appropriate for you. Come out as comfortable with your bosoms through bosom self-test for bosom mindfulness. Ladies may decide to get comfortable with their bosoms by once in a while examining their bosoms during a bosom self-test for bosom mindfulness. In the event that there is another change, knots or other surprising signs in your bosoms, converse with your PCP immediately. Bosom mindfulness can't forestall bosom malignant growth, yet it might assist you with better comprehend the ordinary changes that your bosoms go through and recognize any surprising signs and indications. Savor liquor balance, if by any means. Breaking point the measure of liquor you drink to close to 1 beverage daily, in the event that you decide to drink. Exercise most days of the week. Focus on in any event 30 minutes of activity on most days of the week. Contingent upon that you haven't been dynamic recently, find out if it's okay and start gradually. Breaking point post-menopausal chemical treatment. Mixed chemical treatment may build the danger of breast cancer. Talk with your PCP about the advantages and dangers of chemical treatment. A few ladies experience annoying signs and manifestations during menopause and, for these ladies, the expanded danger of bosom malignant growth might be worthy to assuage menopause signs and side effects. To lessen the danger of breast cancer growth, utilize the most reduced portion of chemical treatment workable for the briefest measure of time. Keep a sound weight. Contingent upon that your weight is sound, work to keep up that weight. Given that you need to get more fit, get some information about sound procedures to achieve this. Diminish the quantity of calories you eat every day and gradually increment the measure of activity. Pick a solid eating regimen. Ladies who eat a Mediterranean eating regimen enhanced with extra virgin olive oil and blended nuts may have a decreased danger of bosom malignant growth. The Mediterranean eating routine spotlights for the most part on plant-based food varieties, like products of the soil, entire grains, vegetables, and nuts. Individuals who follow the Mediterranean eating regimen pick solid fats, like olive oil, over spread and fish rather than red meat. Breast cancer risk decrease for ladies with a high danger. Given that your primary care physician has surveyed your family ancestry and established that you have different components, for example, a precancerous bosom condition, that expansion your danger of breast cancer, you may talk about alternatives to decrease your danger, for example, preventive meds, chemoprevention, estrogen impeding drugs, for example, specific estrogen receptor modulators and aromatase inhibitors, diminish the danger of bosom malignant growth in ladies with a high danger of the infection. These meds convey a danger of results, so specialists save these meds for ladies who have an extremely high danger of bosom malignant growth. Talk about the advantages and dangers with your primary care physician. Preventive medical procedure. Ladies with an extremely high danger of breast cancer growth may decide to have their sound bosoms precisely eliminated, prophylactic mastectomy. They may likewise decide to have their sound ovaries eliminated, prophylactic oophorectomy, to decrease the danger of both bosom disease and ovarian malignancy.